Georgia, Dr. Brown.
The gentleman from Georgia is recognized for 3 minutes.
I thank the gentleman for yielding. I'm a medical doctor, and I've spent almost 4 decades of practicing medicine concerned about child nutrition, about the health of my patients. Doctors do that as family practitioners and pediatricians all over this country, all over the world. But this act is not about child nutrition. It's not about healthy kids. It's really about an expansion of the federal government. And it's an interference in the school system, so much so that the American Association of School Administrators, the Council of Great City Schools, and the National Association of School Boards Association all oppose this act. This is not about child nutrition. This is about more government control. This is not about healthy children. It's about borrowing more money and putting our children in greater debt. It's not about creating a better environment for our children in the schools. It's about more and more control from Washington, D.C. And we've just got to stop that. The American people are acting very strongly against the agenda that this Congress and this president has shown them in the last 2 years. We saw that on November the 2nd. We've got to stop the spending. This is a $4.5 billion bill. And the pay for that our colleagues on the other side have put into place is a farce. It's a farce. It's a lie. And it's borrowing more from our children. And this kind of idiocy just has to stop. It includes a lot of federal mandates. It's going to be extremely costly. And it does things such as create new programs like an organic food plot. Now, I eat organic food. I like the taste of free-range chicken and free-range beef and organic foods. But we don't need the federal government to promote this kind of stuff. It's crazy. It also spends taxpayer dollars to federalize nutrition standards. I'm one who believes in proper nutrition. I've talked to my patients for years and years about proper nutrition, eating properly, taking care of their diabetes and their hypertension, the hyperlipidemias, nutritional means above even prescribing medication. But the federal government has no business setting nutritional standards and telling families what they should and shouldn't eat. This bill contains a lot of hidden cost that it's going to wind up being billions of dollars or more federal spending. And it contains mandates on the states. Yes.
I yield the gentleman an extra 1 minute.
The gentleman is recognized for an additional 1 minute.
It does give extra mandates on the states. The states are already overburdened and suffering financially. Republicans have an alternative to support child nutrition without growing government. But we're not able to bring those things to the floor. Hopefully in the next Congress we'll be able to. We are very extremely concerned about nutrition of our children and adults. I, as a physician, have been spending most of my adult life talking about nutrition and health. But this bill is not that. This bill is a nutrition bill for a bigger government, greater spending, and it must stop. And I encourage my colleagues to vote against this bill. It's disastrous. Thank you, Mr. Chairman.